Good morning, everyone. I'm Haley.
And I'm Crystal. Thank you for joining us today. Today we'll be presenting our Capstone project on workplace health and wellness, focusing on mental health support for nursing staff.
One of the major issues we observed in our clinical setting was the lack of structured mental health support for nursing staff. This contributes to emotional exhaustion, burnout, and ultimately impacts patient safety and quality of care.
Nurses working in high-stress environments are at significant risk. A McKinsey & Co. survey found that more than half of nurses reported burnout and many lacked access to mental health support. These prolonged stressors led to emotional fatigue and long-term health consequences.
The main risk factors include long working hours, high patient-to-nurse ratio, emotional trauma, and lack of professional support. These conditions increase the likelihood of medical errors and reduce nurses' emotional availability for patient education and psychosocial care.
To address this issue, we propose implementing an integrated mental health wellness program. It would include baseline mental health screenings, quarterly follow-ups, confidential access to counselors, monthly workshops, and a strong leadership support to reduce stigma.
If this issue remains unaddressed, we can expect an increase in patient safety incidents, higher nurse turnover, and decreased patient satisfaction. These outcomes also lead to rising healthcare costs and lower team morale.
Our short-term goal is to launch an immediate wellness initiative. Specifically, we aim to have 80% of staff complete the baseline mental health screening within the first month of implementation.
Our long-term goal is to see a 20% improvement in staff mental health scores over 12 months. This will be tracked through quarterly surveys in comparison with baseline assessments.
One barrier is the stigma surrounding mental health. Staff may fear judgment or being seen as weak. To combat this, we'll ensure confidentiality of all survey responses and actively promote mental health as part of an overall self-care.
Another challenge is time. Nurses often don't have extra minutes during shifts. Our strategy is to provide brief, flexible wellness options like 5 to 10 minute mindfulness sessions and mobile accessible surveys.
Nurses will benefit through reduced burnout, increased job satisfaction, and improved teamwork. These improvements also support retention and reduced turnover, helping preserve institutional knowledge and stability.
Patients receive more attentive care from emotionally resilient staff. This leads to fewer errors, faster response times, and an all-over, more compassionate healthcare experience.
This program will require a team effort. Human resources will monitor participation, mental health professionals will lead workshops and counseling, educators will reinforce coping strategies, and leadership will create a supportive culture.
In conclusion, addressing mental health among nursing staff is vital for both patient safety and workforce stability.
By implementing a comprehensive wellness program, we can support nurses' emotional health and create safer, more effective care environments for everyone.
Thank you for your time. These are the sources we use to support our proposal. We're happy to answer any questions.